Hello, my name is Dr. Robert Arnone, coming to you from St. Louis, Missouri. I'm an upper cervical specific doctor, and I'm here to talk with you today about mild traumatic brain injury, mild TBI, also known as concussions. Concussions basically are a mild injury to the head or neck. When we say mild, basically we mean we're not being like run over by a car, we're not having fracture to the skull. It's a hit that really otherwise wouldn't be seen. You might have a bump, you might not, but the big thing that would determine if it's a concussion is that there's an alteration in brain function. So maybe asking some specific questions and the person can't think clearly. That would be a good example of someone who might have had a concussion injury. But here's what I want to tell you. It matters directly who you go to see. What I do is I focus on the brainstem and the upper cervical spine. I personally have had multiple concussion injuries and had many symptoms as a result. It was not until I went to the proper doctor that my life turned around. The medical doctor, the sports medicine doctor, the physical therapist, the general chiropractor, the doctor of osteopathy, the DO, the acupuncturist, none of them can help. None of them are the right person to see for a brain injury. Unless it's going to be more serious, where there's a fracture in the skull and such, then yeah, you should probably be at the hospital for that. And you may be able to go to a certain center that deals with trauma, more serious trauma to the brain. But the mild traumatic brain injury, which is the common brain injury, and that's the concussion, they belong at the upper cervical specific doctor's office. That is the best place to be. Why? Because the injury itself is at the base of the skull, the top of the neck. Ever notice how they say it's a brain injury, the brain rattles in the skull, and it's a bruising of the brain? Well, if it was a bruising of the brain, then how come we don't see it? How come when we go through an MRI, there's nothing there, and they say, everything looks good, it's normal, you're fine, just rest, you'll be okay. That's not the case. The case is that there's an injury, it's at the base of the skull, top of the neck, where the brain stem sits. This is what supplies the brain, and this shutting off the source to the brain results in an alteration in brain function. They're looking at the brain thinking that's where the problem is. That's where the effect of the problem is. That's not where the cause is. That's why people aren't getting better at these so-called concussion specialty clinics. I have had my life changed. I've been concussed many times, and there's no signs at all to show from it. Also, I have seen many patients over many years, and so I've learned to adapt slightly the care to make it better for each individual. It is a different entity. We see a lot of conditions, a lot of tough conditions that result from brainstem interference, pressure, misalignment in the upper cervical spine. But the concussed, the brain injured, is really on its own level, if you will. It's very different. So therefore, the best person to see is the person who is an upper cervical specific doctor who also has much experience in helping those with concussion. That combination is what wins. And it directly matters. Your results will matter. If you see the wrong doctor who says they can help you and they work with you, but then they don't help you, what's going to happen? Well, it may not be as good as you think, because actually we're seeing a lot of people getting worse from receiving the wrong care. And now we have to help them undo the damages that they had from previous care on top of from the injury. So that could be extensive, that could be timely, that could be costly, and pretty much that's what happens. So this video is to hopefully help you find the right doctor quickly rather than later. Reach out to me. I'll try to help you find someone if I can. I will tell you right now, there are not many in the world that have both of those criteria met. But I do know a bunch, and so we may be able to direct you to one of those clinics. Or if it's possible, you can fly out here. The airport's really close. We have accommodations not too far for you, so we can figure it all out if need be. All right, reach out to me, follow, subscribe this channel, and let's see if we can help you too. Till then, take care and God bless.